Welcome to the Community Health Assessment presentation for Delhi Township. This presentation is part of We Thrive, which is an initiative of Hamilton County Public Health. Your presenters for today are Dominique Walker, Karen Schwamberger, and Tom Beauchart. So, for today, we will cover data notes, the community context. We will identify assets and opportunities. We will talk through the Community Voice Survey, which had over 240 responses. We will identify recommendations to address the opportunities that were identified. We will talk about next steps for the Delhi team. And then we will go over some pre-submitted questions from Delhi Township residents.
So I'm going to talk about everyone's favorite subject, data, and where we get the data we use from. At the local level, we obtain data from anywhere we can that's readily available at various levels, such as the county, community, zip code, and census tract. We do obtain the data for this report from various different sources. So the FBI or even your community provides us with our violent crime statistics. Our agency itself collects data for the Hamilton County Injury Surveillance System, which collects injury data from all the hospital systems in the county. This has been on kind of a pause, but we are getting that back up and running. The Ohio Department of Health provides us with a lot of local data in regards to reportable diseases, incidence of notifiable cancer, along with birth and death data. We also obtain demographic and some of our social data from the U.S. Census Bureau, also known as the American Fact Finder Survey. One thing to note about the data, however, is that you might see little diamonds next to some indicators. And the reason for this is because some of the data, specifically for Delhi Township, are based on a small number of cases. So when there's a small number of cases, it's kind of difficult a little bit to distinguish between random fluctuations in disease or injury incidence from true changes in underlying risk for whatever disease or whatever injury we're talking about. And rates that are calculated on less than 20 cases or less than 20 counts are particularly susceptible to this phenomenon. And those rates should be interpreted with caution. We do present them, but we do note throughout with a little diamond of when it's based off of less than 20 case counts. You will see the years that the data presented will vary by whatever indicator shown, and this is because of the availability of finalized data sets. We only try to give you final data so we know in the future what we're presenting won't change. So one of the big questions that we often get when we talk to communities is, how do you present the data and how do you know someone is living in my community? Data throughout this report is presented at a community level wherever we can, wherever we possibly can. However, there might be instances in which the data were not available or could not be calculated at a community level. In these cases, the data might include residents from neighboring communities who are either going to share the same zip code or census tract groups as your community. One particular statistic that we're going to talk about today is not directly about a Delhi Township resident, but it's about the motor vehicle crashes that occurred within the community. So the motor vehicle crash statistics are presented at a community level, meaning that these are presented as the crashes that occurred within Delhi Township limits. So these might include individuals who don't reside in the township, but are driving through to get to places such as if they go to school at the University of Mount St. Joseph, or coming from another community to either work or visit friends or family in Delhi Township. Outside of the motor vehicle crashes, we know someone is living in your community because we have the address of every injury, every death, every birth, and reportable cases of notifiable cancer or disease. And what we do is we then map each address out to determine the exact location within Hamilton County to determine if that individual is a resident that resides within your community or a neighboring community. However, the data we do get is only part of the story. So death and injury provide us with some of the worst outcomes possible, meaning that somebody had to seek care at a hospital or somebody died as a result of their disease or their injury. It's not going to tell you the full story of what's going on in your community. When you're looking at overall true community health, additional sources do need to be considered to fully understand and solve the problems within a community. So that's going to be combining the mortality data, your injury data with your police, your fire, and EMS run data, but also the community voice, the voices of those residents that are living in Delhi Township. Like Dominique mentioned, we're going to be talking today about assets and opportunities. Assets are areas or outcomes that we think positively impact your community, whereas opportunities are the areas or outcomes that we see there's room for improvement in the overall health, safety, and vitality of your community. One thing to note is that assets and opportunities are identified from a review of both the data and by conducting an asset and opportunity audit. So the asset and opportunity audit was done where Dominique and Karen drove around Delhi Township. They took pictures. They looked at the neighborhood and built environment of your community. They also identified various community resources that you have that aren't necessarily captured in the data itself. The assets and opportunities that we identified from the data itself are statistically significant when we compare them to the Hamilton County as a whole. And the assets and opportunities are identified by Hamilton County Public Health staff, and they may differ for what you see as a community resident of Delhi Township. So, to understand and effectively address health and health equity problems in a community, it is important to understand the context in which the issues exist. So, this includes demographics, which are going to be your age, your race, ethnicity, your genders. And these are important to understand for program planning and implementation because it helps us to understand who makes up the population, which can then help determine the possible impact of health patterns and disease trends over time when we're planning programs. So in 2018, Delhi Township had just shy of 30,000 people who called Delhi home. When we talk about the breakouts between our male and our female population, the female population in Delhi Township just slightly outnumbered the male population. We oftentimes look at the age structure of a community as well. And when we do that, we often see a community who might be considered an aging population. And an aging population occurs when the majority of residents are found to be in some of the older age groups. However, when we look at the population structure in Delhi Township in 2018, we can see that the population is spread relatively even across the different age groups. When we look at the race and ethnicity, majority of Delhi Township residents, or 93%, are non-Hispanic white. It's important to identify the racial breakouts in a community because different racial groups have different health challenges, as well as different cultural norms around healthcare. And it's really important to consider these when we're trying to find solutions to improving the health of a community because they all need to be taken into account for successful program implementation. But health equity and the health status of individuals aren't just influenced by one factor, it's influenced by many factors. One way to look at how multiple factors may influence or impact the health of a community is to look at what we call the level of concentrated disadvantage in a community. Concentrated disadvantage is an indicator that shows communities that might be at an economic disadvantage. And we calculate that using 5 different indicators: the percent of individuals living below the poverty line, percent of individuals on public assistance, percent of female-headed households, percent of the population who are unemployed, and percent of the population who are less than 18 years of age. And these 5 indicators are used because typically these groups have the biggest financial burden or the biggest financial stress on a community itself. Concentrated disadvantage is often associated with worse overall health. So a community with higher levels of concentrated disadvantage are often associated with poorer or worse overall health outcomes. In 2018, Delhi Township had what was considered to be medium levels of concentrated disadvantage. So when we compared Delhi Township to all the other communities in Hamilton County, the level of concentrated disadvantage wasn't low or it wasn't really high. It was kind of in the middle. And what this does is it gives us an idea of how these indicators interact with each other to impact the health of those individuals living in Delhi Township. So now that we know a little bit about Delhi Township's community context, we're going to talk through the assets and opportunities. But we're going to start with the assets. Again, assets are areas or outcomes that we as Hamilton County Public Health see positively impacting your community or areas that Delhi is doing good in. Again, these assets and opportunities were identified from a review of the data and by conducting an asset and opportunity audit. Assets and opportunities are identified from the data that are statistically significant when compared to Hamilton County as a whole. And again, these are identified by Hamilton County Public Health staff and may differ from what you see in your community. So the first asset is from 2014 to 2018. The percentage of families with children in Delhi Township where no parents are working is 3.6 times lower than Hamilton County. Looking at the number of working individuals in a household is another way to assess the economic stability of a family. Sometimes only one individual in a family works outside the home. However, oftentimes many families find that they need two wage earners to pay for housing and maintain the family budget. So when we have both parents working, income increases, which may lead to fewer financial strains or stresses on that family. The next asset is the percentage of Delhi Township residents who experience a housing cost burden from 2014 to 2018, and this was 1.5 times lower when compared to Hamilton County. So a housing cost burden is when a family or an individual spends at least 30% or more of their income on just housing costs. Families and individuals who do spend more than 30% of their income on housing often may have difficulty affording other necessities such as food and medical care. Another asset is from 2014 to 2018, the percent of individuals and children who are living in poverty in Delhi Township is lower than Hamilton County. Living in poverty significantly can impact the health of individuals and families. Those living in poverty often have poor health and limited access to health care. Children who are living in poverty are also at an increased risk for poor academic achievement and also inadequate health care access. Another asset related to children is from 2014 to 2018. The rate at which children die in Delhi Township is 2.6 times lower when compared to Hamilton County. Child death, also known as the child fatality rate, is a very specific type of rate that measures the number of child deaths over a specific time period. And we use this as a measure of the overall health of a community. You'll also note that there's a diamond next to this rate, and this is because this is a rate based off of counts of less than 20. So over the time period of the 5 years of 2014 to 2018, less than 20 children died in Delhi Township. Another asset related to children is from 2014 to 2018. The infant mortality rate in Delhi Township was over 1.5 times lower when compared to Hamilton County. So infant mortality is the death of a baby before his or her first birthday, and it's the number of infant deaths for every 1,000 live births during that time period. Infant mortality is often seen as that canary in the coal mine indicator because it's a great way to gauge the overall health of a community. And this is because infant mortality is often associated with factors such as maternal health, access to and quality of healthcare, and other socioeconomic conditions. You'll also note that this is a rate that's based off of less than 20 cases as well. Another asset identified was from 2010 to 2014. The rate at which Delhi Township residents experienced a firearm-related injury was 2.7 times lower than Hamilton County. So a firearm-related injury is a gunshot wound or a penetrating wound from an injury, such as a gun, that was severe enough that warranted the individual to seek hospital care or treatment for their injury. From 2010 to 2014, the rate at which Delhi Township residents experienced a pedestrian-related injury was 1.6 times lower than Hamilton County. Pedestrian-related injuries are injuries where a person was not in a vehicle or was not riding a bicycle or motorcycle and was struck by a car, truck, SUV, or van. Environmental features at intersections and crosswalks, along with the infrastructure of roads in a community, can be associated with pedestrian-related injuries. Another asset was from 2010 to 2014. The rate at which Delhi Township residents experienced an intentional injury was 1.5 times lower than Hamilton County. So intentional injuries are injuries where an individual either inflicted self-harm to themselves or where another person intentionally inflicted harm against another person, so an assault. Another asset is from 2014 to 2018. The rate at which syphilis is newly diagnosed in Delhi Township residents was 4.7 times lower than Hamilton County. So you'll note that this is also a rate that's based off of less than 20 cases. And risky behavior such as sexual behavior increases the risk for sexually transmitted infections such as syphilis, which can have very serious complications when left untreated down the road for an individual. Another asset is that there is a prescription drug drop box for residents of Delhi Township to use to dispose of any unwanted prescription drugs. So this is going to allow residents to properly dispose of any medication so it's safely removed from the community, helping to decrease the accessibility of prescription drugs. Within Delhi Township, there is also a good network of parks that have playgrounds, ball fields, and recreation spaces for residents to use. So this is going to help promote an active lifestyle, allowing residents to seek out physical activity. Another asset is there is an updated community points of dispensing or POD plan for Delhi Township. This is an asset because in the event of mass vaccination or getting medication to the residents of Delhi Township quickly, there's a plan in place to do so that we can effectively and efficiently get up and running quickly. So now that we've talked about the assets, we're going to talk about opportunities or areas or outcomes that we see room for improvement in the overall health, safety, and vitality of your community. So the first opportunity is from 2014 to 2018, the percentage of children who are uninsured in Delhi Township was 1.6 times higher when compared to Hamilton County. So access to comprehensive, quality healthcare services is important to increase the quality of life for everyone. Children who are uninsured may be prevented from receiving early preventative care or necessary immunizations that provide that healthy foundation for a healthy childhood that leads to a healthy life as an adult. So the next three opportunities we're going to talk about are all related to motor vehicle crashes. And again, these are motor vehicle crashes that occurred within Delhi Township limits themselves. So from 2015 to 2019, the percentage of motor vehicle crashes that occurred within Delhi Township that involved a teen driver was 2.5 times higher than Hamilton County. And a teen driver is anybody who was between the ages of 15 to 17 years of age. Motor vehicle crashes are a significant public health concern and they can happen to anyone. However, new teen drivers are at a higher risk for causing motor vehicle crashes than the general public. And injuries due to motor vehicle crashes are also one of the leading causes of death among children in the United States. Another opportunity related to motor vehicle crashes are from 2015 to 2019, the percentage of motor vehicle crashes that occurred within Delhi Township that involved a child as either an occupant, pedestrian, or a driver was over 1.5 times higher than Hamilton County. So this is going to be anyone that is 17 years of age and younger that was an occupant or a pedestrian or a driver that was involved in a motor vehicle crash. From 2015 to 2019, the percentage of motor vehicle crashes that occurred within Delhi Township that were alcohol related was 1.5 times higher than Hamilton County. The next opportunity is the percentage of Delhi Township residents who are 25 years of age and older, and we're looking at their highest level of educational attainment. And at their highest level of educational attainment was a bachelor's degree or higher, and this was 1.3 times lower than Hamilton County from 2014 to 2018. Educational attainment is another indicator that can influence the health of an individual, and oftentimes what we've seen is having a bachelor's degree or higher is often associated with having better overall health. And this is because of the opportunities by having a higher degree offer, such as additional income, can provide financial stability for families to be able to seek the medical care that they need. The next opportunities were identified from the Asset and Opportunity Audit and the Community Voice Survey that was distributed in Delhi Township. So in Delhi Township, there are no tobacco-free policies for outdoor spaces owned by the township. So meaning that if there was a tobacco-free policy, it provides more power to the township for helping to prevent individuals from smoking or using tobacco products on the outdoor spaces owned by the township, which helps to increase the overall health and wellness of the individuals who are using those spaces for physical activity. Less than 1/3 of students in the Oak Hill School District received free and reduced school lunch. However, not all schools in the district participate in the free and reduced school lunch program. So the free and reduced school lunch program provides individuals or families who do not have that financial stability to be able to purchase lunch for their child on a daily basis. This gives them the ability to receive lunch either free or at a reduced cost, allowing their child the ability to access the nutrition that they need during the school time. There are also no schools in Delhi Township with an approved school travel plan through the Ohio Department of Transportation. The school travel plan that we're talking about here is a plan that looks at the overall safety of students as they walk to school, to be able to get to school in a safe manner if they can't take the bus or they can't be driven by their parents to school. One of the top themes in the Community Voice survey that was distributed in Delhi Township were concerns about cleanliness and the litter in Delhi Township. Another top theme in the Community Voice survey were concerns regarding the lack of sidewalks in areas of Delhi Township and overall pedestrian safety. Concerns about safety and crime in Delhi Township were also among some of the top themes in the Community Voice survey. There's also a low community recycling rate of 6.7% in Delhi Township. So those are the assets and the opportunities. Some of those might be a surprise or new, but some of those you might have already known about. So with that, I'm going to turn it back over to Dominique to finish up by talking about the Community Voice, recommendations, and next steps.
Okay, so what is the Community Voice survey? We created a one-question survey that we asked the community and the team to disseminate to anyone in the community to answer. Members of the community were asked, in your opinion, what is the most important issue that affects the health, safety, and well-being of your community? This is an open-ended question that allows us to gather some really good input to see what are some of the concerns in the community. So we like to provide just a little bit of a visual so that you can see some of the most common themes or words that come out of the Community Voice survey. So what you're seeing now is a word cloud of the most common words or themes in the Delhi Township's Community Voice survey. So you'll see things like safety, parks, litter, police, and buildings show up as common themes. So next, you'll just see a few of the responses from the Community Voice survey. One community member said, lack of sidewalks is a concern for me. Respect of fellow citizens is also important. Access to safe travel like bicycle paths is a good goal also. Another response was, we need good police and fire departments, which Delhi has, thankfully. As we've highlighted before, litter is another common theme in the Community Voice survey. Also, not surprising, since we are still in the pandemic, but COVID-19 came up in some of the responses in regards to COVID-19. One community member said, COVID. People need to wear their mask and socially distance. Again, these are just some of the over 240 responses to the Community Voice survey in Delhi Township, and we did get a full spectrum of responses. We do have a handout that is available with all of the responses that we can share out so that you can see what those look like. So the next part that we're going to go over are the recommendations. What we did is we looked at the data that Tom just presented, as well as taking the asset and opportunity audit and the Community Voice survey, and identified what recommendations can be made to help Delhi Township. The following recommendations made will be based on the opportunities that were identified for the Delhi Township community, and they will correspond with one or more of the We Thrive pathways that will help address that specific recommendation. If you're not familiar with We Thrive, it is a community-based initiative of Hamilton County Public Health aimed at improving the overall health, safety, and vitality of a community. It is comprised of 6 different pathways, which are chronic disease, emergency preparedness, environmental health, injury prevention, substance use and abuse, and social health. Using the pathways helps us to provide structure as we identify strategies to improve the health, safety, and wellness of our community. As we move through these recommendations, some of them may fall into multiple pathways, so we highlight what pathway we feel the recommendation falls within. one of the great things is that for a lot of the recommendations we do already have some identified strategies that we can use to help the We Thrive team to address the recommendation. But it also allows for the team to be creative in determining how they see it best fit to address the specific recommendation. The first recommendation is to work with the local schools to increase the number of students who pursue further education. If you remember, we talked about the highest educational attainment data, and that is where this recommendation comes into play. This recommendation also corresponds with the social health pathway. The next recommendation is to identify partnerships to help develop strategies that will increase the number of children who have health insurance. So this is going to be looking at what avenues that we can use to help with whether it's helping families get insurance, get coverage for their children, but this recommendation is also going to fall under our social health pathway. Work with local schools and the Delhi Township Police to educate teams on safe driving practices. This recommendation falls in our injury prevention pathway. Identify partnerships and develop strategies to reduce the number of motor vehicle crashes, especially those involving a child in the township. And you'll notice that this falls within our chronic disease as well as our injury prevention pathway. Continue to implement a child safety seat inspection program in the township and promote resources available to the families. So this one is going to fall within our injury prevention pathway, but this is a great program Delhi has, and this is making sure that more people in the community are aware of this program and have access to it. The next recommendation is to educate residents on the importance of not drinking and driving. This recommendation falls within our injury prevention and substance use and abuse pathways. Partner with Oak Hill School District to develop a school travel plan and implement safe routes to school. As you can see, this covers more than half of our pathways, including chronic disease, environmental health, injury prevention, and social health. Partner with Hamilton County Environmental Services to increase recycling rates within Delhi Township and educate residents on local cleanup efforts. This recommendation is going to fall within our environmental health pathway. Implement tobacco-free policies, including vaping, for all Delhi Township-owned properties, including parks and event spaces with supporting signage. Again, one of the recommendations that covers multiple pathways, with those being our chronic disease, environmental health, and substance use and abuse pathways. Partner with Oak Hill School District to increase participation in the free and reduced school lunch program. This one is going to fall within our chronic disease as well as our social health pathway. Continue to host and expand cleanup days in the township. This one is going to fall under our environmental health pathway. Provide education and implementation strategies to improve safety and decrease crime. This recommendation also covers multiple pathways, with those being chronic disease, injury prevention, and social health. And the last recommendation is work to implement a sidewalk master plan to help connect points of interest in the communities such as parks, businesses, schools, and to improve pedestrian safety. This recommendation is going to fall within the chronic disease as well as the environmental health pathway. So now that we've covered the data and the recommendations, what are our next steps as a We Thrive team or community to improve the health, safety, and wellness of Delhi Township residents? We will review the selected We Thrive pathway or pathways. For the Delhi Township We Thrive team, the initial pathway selected was the injury prevention pathway. We will look to engage additional community members, so inviting people to join the Delhi We Thrive team so that we can identify some strategies and goals to work towards. We will develop an action plan. So this is going to act as our roadmap to implementing strategies identified based off of the data and recommendations that were just presented, and then actually implementing those strategies to improve the health of residents in Delhi Township. So this is really just a kind of, full circle picture of what we look to do as we move forward after this CHA presentation.
Now we're going to move into some pre-submitted questions that came from Delhi Township residents. As you are reviewing the documents for the presentation, if you do have questions that come up, associated with this will be a link to a Microsoft form that you can complete. Your questions will be forwarded to us here at Hamilton County Public Health, and we will answer your question and get your response as soon as we can. The question we have is a common question we get, and that is, why are some statistics highlighted not consistent? They're either percentages or a number per 100,000. So some of the statistics presented do vary by how they're shown. One of the biggest examples are the statistics around motor vehicle crashes. Those are percentages, while our death or our cancer statistics are shown as a rate per something, typically per 100,000. So the reason is because motor vehicle crashes have to be presented at a percentage, because we only have the total number of motor vehicle crashes that happened or occurred in Hamilton County. So in order for us to calculate a rate, we would need to know how many cars or drivers are in Hamilton County, and subsequently how many cars or drivers are in Delhi Township, and how many of these experienced crashes. Unfortunately, the only thing we get is the number of crashes that occurred in the county or within the township. However, the other statistics that we do have, such as the death and the cancer statistics, are presented as a rate because the rates themselves help to better measure the public health burden of these diseases or illnesses. And then the frequency with which health events occur is almost always related to age. And when we calculate a rate, we specifically use age-adjusted rates. That's going to allow for us to remove those differences in age composition to give us a true comparison of your community to Hamilton County. Our next question is, when the data is compared to Hamilton County, what does Hamilton County include and what does it mean? So when we talk about the data being compared to Hamilton County, we compare it to the entire county population as a whole, which includes the city of Cincinnati. So to determine statistical significance, we look at the community rate, the community population, and the county rate to determine if the differences in the rate, whether that's higher or lower, is not likely to have occurred due to chance, but are instead likely to have occurred because of a specific cause. So the next question is, what is a community points of dispensing plan? A community points of dispensing, or more commonly known as a POD plan, are community locations where local and or state agencies will dispense or administer medications or vaccinations to the general public. So the plan refers to the ability for the community to quickly set up and establish the pod should the need arise, and that the number of volunteers needed to run the pod are already identified.
So another question we often get is, where can other community health assessments be viewed? You can see the community health assessments that were completed for other communities by visiting our We Thrive website at www.watchusthrive.org. And then once on the website, you'll navigate to each community's page to see if they have a completed health assessment. It's important to know that only communities that have received a community health assessment through the We Thrive initiative are available on our website. And please keep in mind that not all communities have received a health assessment to date, and based on when the assessment was complete, the timeframes for the data may vary. Another question submitted was, what are the age ranges for a child or teenager when looking at the data? When we talk about a teenager in the case of, say, teenage driving, it's going to be anyone 15 to 17 years of age. When we talk about the age range of a child, it's going to look at any individual that is 17 years of age or younger. That is the community health assessment for Delhi Township. We thank you for tuning in to the presentation for Delhi Township's community health assessment through We Thrive, an initiative of Hamilton County Public Health. Again, my name is Dominique Walker. I am the health educator for Delhi Township's We Thrive team. So if you have any questions, you can find my contact information here on the screen in front of you. I want to thank Karen Schwamberger and Tom Boshart for helping us through this entire process, as well as Delhi Township for being a part of the We Thrive initiative. Thanks again.